Did you know that glaucoma is one of the leading causes of blindness worldwide, and most people don't even know they have it? In today's video, I'll show you how to identify the silent signs before it's too late. Glaucoma, known as the silent thief of sight, creeps in without warning, robbing you of vision before you even notice. In its early stages, there are no obvious symptoms, making it one of the leading causes of blindness. Shockingly, 50% of people with glaucoma don't even know they have it, allowing the damage to progress unnoticed. Recognizing its silent nature is critical for vision loss prevention, and awareness is the first step. We'll uncover the early warning signs, explore what puts you at risk, and give you actionable tips to protect your vision for life. Let's explore the subtle signs your eyes may be trying to warn you about, quiet clues that often go unnoticed. The early warning signs of glaucoma can be so mild that many people dismiss them as simple aging or fatigue. But the reality is, these small changes could be the first signals that glaucoma blindness is silently creeping in. Early detection is key, and recognizing these signs could make all the difference in protecting your vision. One of the most common early signs of glaucoma is peripheral vision loss, or a narrowing of your field of vision. Imagine your side mirrors on your car starting to fade in dim light. At first, you might not notice it, but eventually, it becomes more difficult to see objects on the periphery. This gradual loss of side vision can make it harder to navigate your surroundings safely. While many people dismiss this as a normal part of aging, it is one of the first red flags for glaucoma and requires attention. Another subtle yet important symptom is the appearance of halos around lights. Have you ever been driving at night and noticed bright lights surrounded by fuzzy rings or halos? While this might seem harmless or even a little artistic, it could be a sign that the pressure in your eyes is rising. This pressure is one of the main causes of glaucoma, and seeing halos could indicate that the fluid in your eyes isn't draining properly, leading to increased internal pressure. Frequent headaches or eye pain can also be an early sign of glaucoma. These aren't your typical tension headaches that come from stress or lack of sleep. These headaches often feel concentrated around your eyes and can come and go. The cause? Pressure building up in your eyes. If these headaches start to happen more frequently or feel more intense, it's important to consider that glaucoma could be at play. Another symptom that can sneak up on you is difficulty adjusting to low light or darkness. For example, imagine entering a dimly lit room and finding that your eyes take longer than usual to adjust. You might think it's simply due to being tired or the lighting in the room, but in reality, it could be a sign that your eyes are having trouble processing light effectively. This difficulty in adapting to darkness is often linked to glaucoma, and catching it early can help prevent more severe vision problems. Let's break this down with an example. Picture yourself driving at night. You notice that your usual ability to check your blind spot seems off, or you're finding that bright lights give you an annoying glare. These may seem like minor inconveniences, but they are actually early signs that your peripheral vision and overall eye health are being affected. The issue with glaucoma is that by the time these symptoms become obvious, permanent damage could have already occurred. Blurred vision, especially when it seems to come and go, is another potential indicator of glaucoma. This can occur due to fluctuating eye pressure, which can cause sudden blurring or difficulty focusing. Some people might brush it off as eye fatigue, but recurring blurred vision should not be ignored. As glaucoma progresses, loss of contrast sensitivity can also occur. This means you may find it harder to differentiate between subtle differences in shades of colors or notice details in low-light situations. This can make activities like reading, driving at night, or even watching TV more difficult, but it's often an overlooked sign until the condition has worsened. Nausea and vomiting might seem completely unrelated to eye health, but they can actually be signs of acute glaucoma. If the eye pressure rises very quickly, it can cause intense eye pain, nausea, and vomiting. If you experience these symptoms alongside other vision issues, it's critical to seek medical attention immediately. The important thing to understand is that glaucoma doesn't just appear out of nowhere, it's a gradual process. The symptoms can often be so subtle that many people don't notice them until significant damage has been done. So recognizing these early signs, no matter how small they may seem, is essential in preventing serious vision loss. Now that we've covered these potential warning signs, the next step is to understand what might be putting you at risk for developing glaucoma. Let's take a look at the factors that make certain individuals more vulnerable to this silent sight thief. Some of these risks may be more relevant to your life than you realize, so it's important to understand how they contribute to your overall eye health. First and foremost, age plays a significant role in the development of glaucoma. Once you're over the age of 40, your chances of developing this condition increase. It's not just about getting older, it's about how your eyes naturally change over time. As you age, the structures responsible for draining fluid from your eyes become less efficient, which can lead to increased eye pressure, one of the primary causes of glaucoma. Family history is another important factor to consider. If glaucoma runs in your family, you're at a higher risk of developing it yourself. While this type of inheritance isn't something anyone wants, it's crucial to stay vigilant if you have relatives who've been diagnosed. Genetics can play a big part in your eye health, but awareness is key. By staying proactive and getting regular eye exams, you can catch potential issues before they become serious. Certain ethnic groups are also at a higher risk for glaucoma. African Americans, for instance, are 5 times more likely to develop the disease than Caucasians. On the other hand, people of Asian descent are more likely to develop angle closure glaucoma, a specific type of the condition. These statistics aren't just numbers, they're a wake-up call. Regular checkups are essential for people in these high-risk groups to monitor for early signs of the disease. Underlying health conditions can also contribute to the development of glaucoma. If you have chronic issues such as diabetes, high blood pressure, or migraines, your risk for glaucoma may be higher. These conditions can negatively impact blood flow and cause fluctuations in eye pressure, both of which are linked to the onset of glaucoma. If you manage any of these health conditions, it's crucial to keep them under control and schedule routine eye exams. A history of eye injuries can also increase your risk of developing glaucoma. If you've experienced trauma to your eyes, the risk of glaucoma can go up later in life. This is particularly true if the injury affected the drainage system in the eye, making it harder for fluid to escape and causing a buildup of pressure. It's important to monitor your eye health regularly if you've had any previous eye injuries. Even medications can play a role in raising your risk of glaucoma. Some prescription drugs, such as corticosteroids, can cause increased eye pressure over time. If you're taking these medications, make sure your doctor knows about your history with glaucoma. In some cases, switching to a different treatment can help mitigate the risks. Another risk factor is high myopia, nearsightedness. Those with severe nearsightedness may have a higher chance of developing glaucoma due to the structural differences in their eyes. If you've been diagnosed with high myopia, it's especially important to stay on top of your eye health with regular eye exams and monitoring for any changes in your vision. Lifestyle factors also come into play when considering glaucoma risk. Smoking, excessive alcohol use, and lack of exercise can all contribute to poor eye health. Maintaining a healthy lifestyle can reduce your risk, so consider adopting habits that support overall well-being, such as regular exercise, a healthy diet, and quitting smoking. Lastly, gender can affect your risk for glaucoma. Studies have shown that women are more likely to develop glaucoma, particularly after menopause. If you're a woman over the age of 60, it's important to be proactive in monitoring your eye health and take preventative steps to reduce your risk. If you fall into any of these high-risk categories, whether it's due to age, family history, ethnicity, health conditions, or lifestyle, taking proactive steps to protect your vision is essential. It's not a reason to panic, but rather an opportunity to act now, before the damage is done. And don't worry, there are steps you can take to safeguard your sight, and we'll discuss them next. Now that we've laid out the risks and early signs, it's time to get proactive. Protecting your vision from glaucoma blindness doesn't have to be overwhelming. With the right steps, you can keep your eyesight sharp and stay ahead of this silent thief. Let's break it down into simple, actionable strategies that anyone can follow. First and foremost, schedule routine eye exams. This is your first line of defense. A comprehensive eye exam can detect changes in your eye pressure and optic nerve long before you notice symptoms. If you're over 40 or fall into a high-risk group, aim for an exam every year or two. Not sure where to start? Most optometrists offer affordable screenings, and some clinics even provide free checkups during glaucoma awareness campaigns. Next up, manage your eye pressure. If you've been diagnosed with elevated pressure or glaucoma, follow your doctor's advice to the letter. Medications like eye drops are highly effective at slowing the progression of the disease. For those wondering, yes, Lifestyle changes can help too. Reducing caffeine, avoiding smoking, and practicing stress relief techniques like yoga can contribute to lower eye pressure. Speaking of lifestyle, let's talk healthy habits. A diet rich in antioxidants, omega-3 fatty acids, and leafy greens isn't just good for your overall health, it's great for your eyes. Foods like spinach, salmon, and carrots can give your vision a natural boost. And don't forget hydration. Keeping your body well hydrated helps maintain healthy eye pressure. In today's digital world, avoiding eye strain is a must. Hours spent staring at screens can lead to fatigue and dry eyes, which won't directly cause glaucoma but can exacerbate other vision problems. Use the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. Trust me, your eyes will thank you. Finally, know when it's time to see a specialist. If you experience sudden vision changes, like blurriness, loss of peripheral vision, or severe headaches, don't wait. A prompt visit to an ophthalmologist could make all the difference in catching glaucoma early and preventing blindness. Glaucoma doesn't have to be a mystery or a silent thief in your life. Today we've uncovered its secrets, from understanding what it is to recognizing the subtle symptoms that often go unnoticed, identifying the key risk factors, and learning the actionable steps you can take to safeguard your sight. Awareness is your most powerful tool, and now you're armed with the knowledge to protect your vision and take control of your eye health. So, ask yourself, have you experienced any of these symptoms? Is it time to book that overdue eye exam? Don't ignore the quiet signals your eyes might be giving you. Share your experiences in the comments. I'd love to hear your thoughts and help answer your questions. If you found this video valuable, please give it a thumbs up and share it with someone who might benefit from this information. And don't forget to subscribe to the channel for more health tips that can truly make a difference in your life. Click the video on your screen right now to continue your journey toward better eye health.